Hi, Dr. Ouellette. It's been a while, but I'm thinking of taking up tennis again. Boy, tennis is really popular and pickleball. But before I do, I'd like to know if there are any specific risk factors that make some players more prone to wrist injuries. Good
Well,
question.
so for tennis, we've just been through this. Your average human, 80% of dead people have a tear in this ligament.
Right.
And that is tennis. That's golf, too. By the way, the non-dominant hand in golf. And so there are risks. But once again, you want to do it for the social, for the cognitive support that it gives you. You want to do it. So how can you minimize the injury? Well, number one, work on your form. So if you haven't played tennis before or you're going back to it, please work with a pro. And so when I have dealt with wrist injuries with pros, one of the most successful things that I do is have them work with their coach and use the sport to strengthen what they're doing and to get the correct form. But don't be afraid of taping. Don't be afraid of using a wrist widget. You're not going out there to compete in a way that you can't wear those things on the court. And so that's what you want to do. And will you actually prevent wrist instability? Don't look at it that way. It was coming because you're human. By the way, why is that? We are dart and javelin throwers. The other primates cannot do this because this bone attaches to that bone and prevents that motion. So that's why they do the chop, putting the stick down the inside of the termite hill. We don't have to do that. We can drop it in like this. So that's why we get into these troubles. So just, wear splints, protect yourself. You can't strengthen it, but make sure that you have the right form.